Hey everyone, Dr. Mike here, and welcome to How to Actually, where we empower you with practical knowledge to conquer any situation. Today we're talking about something incredibly important, first aid. You know, those crucial actions we take in the first few minutes of an emergency. Welcome to our essential guide on first aid emergency procedures. Knowing these tips can make a life-saving difference in critical situations. Imagine being able to help a loved one, a stranger, or even yourself during an accident or sudden illness. That's powerful stuff. And it all starts with understanding the basics. We'll break down everything step by step, just like we do in the hospital, so you can feel confident and prepared to act when it matters most. So let's dive in and equip you with the skills to become a first aid hero. All right, so you find yourself in a situation where someone needs help. The first thing, and I can't stress this enough, is to assess the scene. Is it safe for you to approach? Well, look for things like traffic, fire, or anything that could put you in danger. Remember, you can't help someone if you become a casualty yourself. Once you've determined it's safe, check on the person. Are they conscious, responsive? Your safety and well-being are paramount. Take a moment to observe the surroundings. What happened? Are there any bystanders who can assist? Gathering information quickly will help you make the best decisions moving forward. Let's talk about CPR, or cardiopulmonary resuscitation. This is a life-saving technique used when someone's heart has stopped beating. First, lay the person on their back on a firm surface. Then, place the heel of one hand on the center of their chest, right between their nipples. Interlock your fingers with your other hand, and keep your arms straight. Now push down hard and fast, about 2 inches deep, at a rate of 100 to 120 compressions per minute. Think of the beat of Staying Alive by the Bee Gees. That's the rhythm you're aiming for. Continue these compressions until help arrives. Choking is a scary situation, but knowing how to perform the Heimlich maneuver can be a lifesaver. If someone is choking, stand behind them and wrap your arms around their waist. Make a fist with one hand and place the thumb side just above the navel, below the ribcage. Grab your fist with your other hand and give quick, upward thrusts into their abdomen. Keep doing this until the object is dislodged or they become unconscious. In that case, carefully lay them down and begin CPR if necessary. Severe bleeding requires immediate action. If someone is bleeding heavily, first put on gloves if you have them to protect yourself from bloodborne pathogens. Then apply direct pressure to the wound using a clean cloth or gauze. Push down firmly and elevate the injured area if possible. If the bleeding doesn't stop, you may need to apply a tourniquet. A tourniquet is a tight band placed above the wound to restrict blood flow. Use a wide piece of cloth and tie it tightly a few inches above the wound. This is a last resort, so only use it if absolutely necessary. In any emergency, calling for help is crucial. Once you've assessed the situation and provided basic first aid, dial 911 or your local emergency number immediately. Stay calm and be prepared to give the operator your exact location, a clear description of what happened and the number of people injured. Listen carefully to their instructions and answer any questions they may have. Remember, emergency services are trained to handle these situations, so the sooner they arrive, the better the outcome. And there you have it, essential first aid procedures that could make all the difference in an emergency. Remember, staying calm and knowing these first aid procedures can save lives. You've learned how to assess a scene, perform CPR, assist with choking, control bleeding, and activate emergency services. That's powerful knowledge. Always seek professional medical help when needed. First aid is about bridging the gap until those professionals arrive. You've got this. Thanks for watching and stay safe. Don't forget to subscribe and share this video with your friends.